I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about sexual health in South Asian women, and it's going to be an awesome conversation. But before we get into it, the first thing I want to make very clear is this is not any form of religious or medical advice. If you have any questions about your medical health, make sure you go speak with your medical provider. And if you have any questions about your religion, make sure you go see your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm super excited to have on with me Dr. Sukhpreet Patel. And Dr. Patel, if you could please introduce yourself to the viewers and the listeners out there and just let them know who you are.
Well, thank you so much for having me here, Sadaf. And it's been a pleasure being here. And so you've already introduced me. I'm Dr. Sukhpreet Patel. I am an MD OBGYN from India, mainly my practice is in Mumbai. I moved to Vancouver, Canada a few years ago. With the goal of working in public health. I have a master's degree in public health from the UK. And I'm an enthusiast when it comes to lifestyle. So exercise, nutrition, health coaching gave me a very different perspective on women's health. And all of this together, the gynecology and the public health and nutrition, exercise, etc., one fine day evolved into Menopause Wize, and that's how the story began. And now Menopause Wize is basically my passion, my dream, my vision of creating a world where every person is equipped with good, credible information about menopause and menopause health, similar to what you're doing with the Muslim Sex Podcast.
Amazing. I love it. So yeah, I was going to ask you about the title, Menopause Wize. So that is awesome. And so, I'd love to get into learning a little bit more about kind of your practice. And, I think that for those viewers and listeners, let's say they haven't listened to any of my other podcasts, maybe you could just tell them a little bit about, kind of what happens in perimenopause, menopause, that you think affects a woman's sexual health overall?
So as we all know, there are a lot of hormonal changes happening around perimenopause, which can start up to 10 years before menopause. And as we know, menopause is 12 months from a woman's final menstrual period. But as I mentioned, perimenopause can start up to a decade earlier, and changes similar to, it's the other end of the reproductive age spectrum, as many of us call it, adolescence on the other side. So it doesn't happen overnight. We see a slow decline in hormones, estrogen, progesterone, testosterone for some women. And those declining hormones then start changing a lot of things, especially in the tissues around the vagina, the vulva, the urethra, the urinary bladder. There's a whole load of receptors there when it comes to hormones, and declining hormone levels then starts to change how it appears to the woman, how she feels down there, and a bunch of symptoms, including painful intercourse, recurrent UTIs, having to pee many times at night, and I think one of the symptoms that's not spoken about enough is discomfort or pain during intercourse.
Yeah, absolutely. And, just what you mentioned, of course, there's, we know that the vulva is super, receptive to hormones. And we know the vestibule that you and I talked about before is that, that area, the entrance right into the vagina. And that is very, very sensitive to hormones, specifically estrogen and testosterone. And so when we don't have those, right, in menopause, and even it can start to be painful in perimenopause, or even with somebody that's been on birth control pills. That can cause a lot of pain with sex. And so it's important for women to know that there is treatment. There's an estrogen testosterone compound cream that we can write for you that can get rid of that pain on insertion with penetrative intercourse. So, it's things like that. I agree with you. I think that, not a lot of women know that sex is not meant to be painful. And I think that we suffer through a lot of things in general, right? We suffer in our menstrual, when we have our periods, we suffer with endometriosis and fibroids and child labor and contractions. And then we, decide that it's good to keep suffering our whole life. So we continue to suffer in perimenopause, menopause, pain with sex, and we just think, well, women are meant to suffer. So I guess I'm just taking one for the team, right? And just continue to do
Yeah.
that.
Yeah, there's some sense of pride in martyrdom,
Yeah.
especially in South Asian women. And I remember speaking to a psychiatrist colleague of mine, and she says it's like the suffering Olympics.
Yeah.
It's like we feel like who suffered the most,
Yeah. Right.
and
They always
there's a
say,
sense of pride in that,
yeah, yeah,
which I
yeah.
feel like we can separate that out and say, hey, but why? But
Yeah.
why? Yeah.
Right. Right. Yeah. When patients would tell me that they didn't want an epidural, I would say, like, listen, that's fine. You don't want an epidural. Totally fine. This is your labor. You decide. You get to decide what you want to do. I said, but just remember that no one is going to give you a medal at the
Yep.
end of this, right?
Yep.
Like, there's no award. So
Yeah.
if you decide you want to just do it totally without anything, good for you. That's not what I did.
Yeah. Yeah.
I knew I wasn't getting an award. So I
Yeah.
knew I
No,
wanted.
no, and I think that the reason needs to be the why needs to be clear. Why do I not want to take the epidural? Just to go through the pain.
Right.
I usually say in a different way, I'm like, just because you undergo a C-section doesn't mean you love your child less.
Right.
Just because you didn't go through labor doesn't mean you love your child less. So hence, if you just because you go through perimenopause and menopause without hormones doesn't mean that you will have there's a pathway that's going to be rewarded at the end of it. So one can choose to do it just because they chose to do it to relieve their symptoms.
Yeah, yeah, and I like that, being clear on your why, right? And that's with anything in life. Like, why are you doing, X, Y, or Z? And I love that, because I think that's really important to know, like, what is the motivator, right? What is your why? And so, when you, let's say, when you are seeing your patients in India, and or when you are practicing there as a gynecologist, do you hear South Asian women say stuff like, well, this is just what happens with my age, and especially if they're experiencing painful intercourse, or even if they're having intercourse at all?
Absolutely, absolutely. I think there is a greater degree of ageism that's self-destructive amongst Indian women.
Yeah.
That the concept of and I've heard my mother, my grandmother, all of them say this, like, but I'm 54, and I remember my mother calling herself a buddhi when she was 54, and I'm like, I'm not ready to accept that title yet, and I feel um, with that with that sense of I'm old comes the acceptance of this is just like that. ऐसे ही है. It is
Yeah.
just like that.
Yeah.
And it is how easily it comes to us that I'm not supposed to, I'm not supposed to be visible. My pain's not supposed to be visible.
Yeah.
And so absolutely, absolutely. I think there is the perception is very different among South Asian women, that it's the acceptance of pain. It's just normalized that this is the way it's supposed to be for me, and it's just a natural part of aging.
A hundred
There's nothing
percent.
really natural about pain.
Yeah, yeah, it's strange, but yeah, you're 100% right. It's just it's accepted, and it's just normalized, right? Like, there's as if there's like nothing that can be done about it. So I think that's very true. So how do you think cultural conditioning influence whether South Asian women speak up about discomfort?
Well, I think it is just millennia of conditioning. So we're looking at um, something that's so deep rooted that we don't even know it exists. So it's not even visible to us as an entity that we're doing this intentionally. So I feel like it is women of our generation that will probably take it on themselves to say, hey, this is not normal. We're beginning to question, but I feel we've been shaped, and even today, as someone who is talking about this openly and who is advocating for women, I think there is a part of me that keeps going back to that woman who wants to keep quiet about it. And I have to remind myself, hey, no, you don't do that. So I think it's so, and for me to kind of visualize this as the third party, like from an outside, and then look at myself, look at my behavior and say, what are you doing? So I think it's in our DNA. It's as if it's evolutionarily even passed down to us, as if there is a gene that's making us do this. So it is that deeply ingrained that we are unable to even identify it today, and it's going to take a while to undo it.
I love that because that is so fun. When you said that, I was thinking about what just something that happened just this past Friday. So, my episode came out on the Muslim Sex podcast about orgasms. Okay. And so my virtual assistant wanted to write on it, on the cover, how to have an orgasm. Okay. And I looked at it and I said, oh no. So I feel I literally wrote to her, I said, I feel really uncomfortable with that title. You got to change it. I just can't. I can't have like, and even though that's what it was about, like it was about like, like how to, um, I didn't really talk specifically about like different positions or stuff like that. But I did that on a different episode. Actually, I talked about erogenous areas and stuff, and I can't remember what I talked about on this episode. But it was about orgasms. It's about how to have an orgasm, how to focus more on the moment, and this and that, blah blah blah. But I felt so
Mm.
uncomfortable with that title.
Mm.
And this is a
Mm.
Muslim sex podcast, right? But I was like, I can't have a title that says how to have an orgasm. I said change it. So the title became, if you look on my thing, you'll see it says something about like changing the orgasm gap, what every woman should know. So it was almost like a euphemism, like so that it wouldn't say how to have an orgasm, because I felt so uncomfortable. So yeah,
Yeah,
I
yeah,
just couldn't do
yeah,
it. Couldn't do it.
yeah,
Yeah.
yeah.
It's funny that you should say that. So what about in your women that you see in India? How, do you notice hesitation with South Asian women when discussing treatments like vaginal estrogen, lubricants, pelvic floor therapy? I love the fact that you have a vibrator on your desk that you just kind of keep there. I'd love to know what women, first of all, do they even know what that is? And then are they like, what is that for? Like what happens when they see that?
Yeah, so I think most women in India, and my office is in Mumbai. So
Okay.
Mumbai, I would say, is most forthcoming amongst all the cities in
Right.
in
It's
India.
very progressive.
And yeah, and I would still, I think most women have said when I ask them, so one of the ways of eliciting libido is the history of trying to understand their desire is, okay, so you don't have the desire to have sex with your partner, but what about self pleasure? And do you have any sex toys? And I think when I inquire about self pleasure, there's that first, oh my god, that's uncomfortable. And then the next layer is about sex toys, and I haven't come across a woman who has told me that she possesses one.
Yeah.
And when that thought is put in her head, then I can see at the end of that conversation, she's like, "Well, next time I travel, I'm going to get some." But there are a couple of brands now available in India, which is recent. But they still don't focus around midlife women and their pleasure. It's a very young women's concept, and I feel there's hesitation in, oh, but I already have a partner, how can I get a sex toy? Or I'm married, how can I have a sex toy? And I think that whole so yeah, so when they look at it, I don't think most of them understand what it is. It's a little mini vibrator, so I kind of take it out of the little bowl it is, and put it on the table and say, hey, how's libido? And it's a little, they're a bit taken aback by it initially, but I think they see the intention. The intent is clear, that hey, we're going to talk about this because you may not bring it up, but I do, and I don't want to bring it up. And I think once once the conversation starts, then you can see them gradually participating in it, and not unhappy that someone brought it up. So.
Yeah, that's such an interesting topic because, there's so many what India is really just, I think it's, people don't realize that India is so diverse, right? In terms of like religions, in terms of beliefs. I mean, India has, right? They have Sikhs, they have Hindus, they have Muslims, they have, Jain, they have so many different religions there, right? And so each different religion has their own idea of like masturbation and whether or not it's permissible or it's not permissible and things like that. So how do you broach that topic? I guess do you kind of have in your head like, okay, this person is, I don't know, let's say they're Muslim or something like that. Like how would they feel? Do you get like different religions of women that some are more receptive than others when you bring up the topic of like say sexual health?
I think there are certain women who are more resistant in speaking about it. Definitely, definitely. I feel women who follow Jainism very strictly, they're very restricted in speaking about it. I don't find that very common with Muslim women.
Oh, that's
But
good.
I see, because I feel I'm also looking at Mumbai. Now, Mumbai is an amazing blend. And to be
Yes,
honest, for me, a woman is a woman sitting across me, and
yes.
it's not really about religion,
Religion.
unless they're saying, oh, it's Ramadan, I can't take my pills, or there's a Jain fasting period, I can't take my medication. Then I don't see it impacted as much. I think it may be because of the way Mumbai is. Like it can be, yeah. I think we have learned to coexist so beautifully in that space. And yeah, so it doesn't really, I don't see it impact as much. But Jains, somehow I feel there is more shame attached to sex, and I may be wrong. This is my perception, but
Yeah.
this is something that I've experienced when I'm speaking to women of that
Yeah.
culturally Jain. But yeah, I think most women, once the door is open, they're okay about it. That initiating it is a real problem. um, Initiating the conversation is a problem for them, and I feel that's why providers need to be proactive, that we need to put it on the table, we need to speak about it. I think there are some studies which say 70% of healthcare providers won't start the conversation, but I feel more than 90% of Indian providers are not beginning that conversation, and that's the thing that we need to change. Because if a woman attaches shame to it, because you know what, she may have been turned down when she opened the door. She may have been told, but you're too old. I've had women tell me, the last provider I spoke to, she said, now you're 50 plus, now what do you want to take care of your sex? Your
Oh my
sex is not
gosh.
important in this. And I think that's the problem, right? We're talking about providers telling women off,
Yeah.
and attaching shame to it. So they're not going to open that door. They're
Yeah.
not going to speak about it. Yeah.
And you're so right. You brought this up in the beginning. You talked about ageism, and I think that is so true, right? And it's almost like we propagate that as physicians, right? If we don't place importance on something that our patients place importance on, right? And my focus in my practice is primarily perimenopause, menopause, and sexual health. So I always focus on that. But I can see how, like, as a generalist, and I think perhaps in maybe the subcontinent, maybe more, that people will say that, well, you're older, why should you care about that, right? And just like what you said, like, if you go to a doctor that is uncomfortable talking about sex, you're going to notice that they're uncomfortable talking about sex. So then you're never going to bring it up again, because you're going to be like, well, they didn't feel comfortable, so then maybe it's something I should feel uncomfortable with, and then I'm just not going to bring it up, right? And then they'll just go forever until they find a provider that actually can speak to them without shaming them.
Or they won't go. So
Yes.
they won't bring it up with the next provider because that's scarring enough. And I feel what happens is that, again, this is where Indian woman or like a South Asian woman going to a South Asian provider, and that provider herself is dealing with her own problems with sexual health, and she has no answers for it or is too shy or embarrassed to do something about it. She herself is not giving it the importance because of how she is culturally been exposed to the fact that she's not supposed to have this. So basically, I feel what happens is that Indian providers or South Asian providers tend to then project themselves
Mm,
onto this other woman because
yes.
they're blending in with that context. So for them, they're dealing with their own cultural not, I wouldn't call them problems, but their own cultural issues, and that aren't allowing them to seek pleasure or seek that pain-free intercourse. And then it gets passed on or projected to the woman, and in the conversation it becomes, okay, this is normal. So now they've got someone else who hasn't validated their need for a pain-free intercourse, and instead has given their stamp of approval that this is normal and deal with it. So again, we are looking at not just hearing it from your mom or your grandmom or your aunt or your sister normalizing it, but now a person of authority who you seeked help from has now endorsed that this is normal, and you are old, and you may live now for the next 30 years, and you will be sexless.
Yeah. Yeah. I'm wondering, so in terms of, like, your residency, did you get anything in residency training about sexual health or menopause or anything
I
like that?
wish. I wish.
I didn't either, but I didn't know if you had gotten anything, and okay, so that's comforting to me that I'm not the only one that didn't get anything.
Well, it was this one little chapter on menopause in this one textbook which you read. No, there wasn't much on hormone therapy. And I remember I finished my residency in '99, and at that point we were prescribing hormone therapy in the OPD, and suddenly came 2002, and prescriptions just fell flat, and then it was forgotten. I spent most of my career then in IVF and fertility medicine. So for me, menopause was this distant, for me, it was distant chronologically, and it was distant from the kind of care that I provided. So I didn't really bother with it till it hit me. And then I was like, oh, what do I do about it? So I guess personal need trumps everything. But yes, I wasn't, and that's when I felt lost, and the need that, oh my God, I wish someone had trained me to take care of these women who need this help, because now I need it.
Yeah. Yeah, 100%. So then what about the women that, are they excited when you tell them about, maybe pelvic floor therapy or lubricants or vaginal estrogen? Are they really receptive to that?
Well, yes and no. I think there are women who are happy to try everything but hormones. The minute they hear the word hormone, they get a little afraid, and the fear attached to hormones is huge. Again, when we look at the population that I'm seeing in India, they're they are very concerned about using things which are unnatural. So there's
Yeah.
a lot of weight attached to the word natural,
Mm.
and everything seems unnatural.
Yeah.
I think it's a very convenient unnatural, because cars are not natural, Instagram is not natural, this
Yeah.
podcast is not a natural thing.
Right.
But we choose what we're going to attach that natural to. So I most of the times I feel there is resistance in these things because they're considered unnatural. But
Mm.
as we discussed earlier, once there's a lot of education involved, a lot of information provided, a lot of listening to their concerns, and once they're educated about how the genitourinary syndrome of menopause can be, it is progressive, and it'll only get worse as we get further away from our last menstrual period. Once that is that, and it requires consistent treatment once started. Um, and the benefits far outweigh the risks. I think once women are able to understand that, they do tend to accept treatment. The problem is, again, I don't know if you face this in Pakistan, but in India, there is no concept of space, and there is no concept of letting people be. So there's always unsolicited advice. Um, this one's chachi, that one's mama, this
Yeah.
one's foi. Someone always has some advice to give. And the problem is, these women, sometimes you convince them, you spend so much time, like, again, 90-minute conversations on the whole range of treatments and what they can do and what is normal and not, and then they come back with someone's aunt's niece something said that this causes cancer, and I'm like, oh my god, you just undid everything. So
Yeah.
that is like a social problem that we face over there.
Yeah. Yeah. So tell me, when you start to bring up the topic of libido in your practice to your South Asian women, are they, how do they, like when you start to initiate, who initiates that conversation? Do you initiate? Do they initiate? And then, are they likely to ask about what they can do, since you do have that vibrator, or, do they even consider it to be something that's important to talk about?
Well, most of the times, no. The primary reason for coming to the office is usually not libido. We do have a questionnaire, and I ask for it intentionally. It's always one of the questions that, despite it being on the questionnaire, some women will not take it off, but when nudged, they may bring it out when they're asked about it. But I sense there is a sense of relief when I think the question is posed, because then they feel, oh, okay, I didn't ask, someone else did the asking, and I just replied. So I feel that happy to lead the conversation and to open the door. I also feel like very few partners accompany women in the office, and hence that input is sometimes missing, because a woman may sometimes just brush it off. But the minute I ask about libido and there is her husband sitting in the office, there will be that look that he'll give her, that, oh, she's asking about this. And I think that conveys a lot to me, that, hey, you know what, maybe you think it's not important for you, or that it's not impacting your marriage, but that look on his face, he's like, oh, can we do something about it? So maybe it is impacting a part of your marriage, and maybe he's just not expressing it just now.
Yeah.
Yeah.
I think it's great that you have both partners come in there. Oftentimes I see that there would be some hesitation. I wonder if you see this though. Do you see it like, do patients get really embarrassed when you start asking them about sex? I feel like there's a lot of shame, like hidden shame, and thinking that perhaps it's wrong, or, to talk about these kind of topics. So what do they do? Do patients get upset, or are they just really forthcoming and, excited that somebody's finally asking them?
I think like this is of course my interpretation. I feel most of them feel a sense of relief that someone asked, but I also, the initial bit for most women is that but you know what, yeah, it is low, but you know what, it doesn't really bother me that much. There's that little shame in saying, hey, you know what, I just want my libido back. So
Yeah,
so
right.
so there is that, because I think they put themselves in that good girl bad girl bucket, as we were discussing earlier, that there is that, if I say I want, am I going to sound like that that woman who wants sex? Like, am I going to become that woman who wants sex? So I think that that hesitance definitely is there, but there is a sense of relief beyond. So I think the important thing is getting past that little bit of shame, and then once you normalize it and say, you don't blink while speaking about it, and you're comfortable with the flow, then they just feel, hey, this is normal conversation.
Yeah. When you mentioned that good girl, bad girl, what, when they're thinking, because, you were raised in India, and I'm just curious, when they think, let's say, that bad girl, are they thinking of like a bad girl as like a prostitute? Are they thinking like a bad
Hmm.
girl is, what is like a bad girl? Like a good girl is somebody that maybe doesn't talk about sex. Maybe you could just expand a little bit on the good girl, bad girl.
Hmm. Well, I guess the good girl, bad girl can be taken in so many different, there's a full spectrum, right? But I think, yes, with a cultural context, if you're looking at a girl being raised in Mumbai or in India, and saying, hey, firstly, let's not want, just take what's given to you and be grateful for it. I think a lot of us just grow up like that. That,
Mm,
be grateful for what you're given, don't ask for more.
yes.
And and fortunately, I don't have a brother, so I never faced the difference in being brought
The
up
double standard.
between a male and a female. And I keep saying I'm very grateful I don't have a brother, but it can be really, it can be pretty different, right? For
Yeah.
a woman and a male to be growing up in a South Asian community, there
Yeah.
can be a very clear line. Like he can talk about sex, but no, 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 you don't do that. He can bring
Absolutely.
a girl home, but don't you dare bring a boy home. So I think that whole, he can have sex before marriage. Don't you dare think about doing it. Right. And I think those lines are drawn, they're invisible, but they're just there. There is an assumption that, oh, you're getting married at 35, of course you're a virgin. Let's not even have that conversation that that you've had sex. But 30, because you just cannot have premarital sex. So I think that good girl bad girl is very, as I said, there's a spectrum. But in the South Asian context, it would mean wanting any sex at any age. Premarital, forget about it, you're definitely, like, forget bad, you're the worst girl. But if you're looking at middle age, again, a big thing, why do you want? Why should you want? You have your children, you know be happy with their happiness. You brought that out earlier. It's like, you have to be content with everyone else's happiness. Your happiness, it doesn't matter. So the minute you want happiness, so it's not even got to do with sex, I feel. It's like, just the fact that I am prioritizing me makes me a bad girl or a bad person. So,
Selfish.
yeah, absolute selfish. It's not self-care, it's selfish. So if I tell my children have this standard protocol. Do not call me after 9:30. If you do call me after 9:30, it is an emergency. So they have standard protocols in place. Mom's sleep is super important to her. But it's taken a while, right? I had to draw those lines. I had to identify those lines for myself first,
Yes. Yes.
because coming from that cultural context where my mother didn't respect her boundaries, and she let us do this, and we did it.
Yeah.
We did
Yeah.
it. And so
100%.
yeah, and I feel like I want to draw those boundaries, not only for myself, but I want my daughter to learn that this is what she needs to do, and my son to learn, like, hey, you know what, your partner will go through menopause at some point in time. You need to know about it. So I think that that bad girl mold can be so different for us, and maybe it'll be different for the next generation. But for our parents' generation, uh, it was the line was pretty. Um, the threshold was pretty low.
Yeah. Yeah. And I think, like, say that, a person wants sex and then they're deemed to be, let's say, like a bad person or something. I think that that wreaks such havoc in the mind, right? Because then all of a sudden, then you have this perception like I'm a bad person because I want this and this is wrong and it's shameful and it's dirty and all of these thoughts, right? And I think that then you really need to undo that as a physician, and to let people know that that's not who you are. First of all, and there's nothing wrong with you. And we talked about that a little bit with your Instagram also, is that, when people talk about, oh, she has a high libido or she has a low libido, like what is that in relation to? That's probably in relation to her partner, who maybe he has a really low libido. And so hers just seems higher, but hers could probably just be normal, right?
Mm,
And so there's a lot of shaming that goes on, like, oh, well, why do you have such a high libido? Well, what's
yeah,
wrong with you?
right,
Why,
yeah,
what have you done in the past that now all of a sudden, this isn't enough for you, right? Like
right,
all of
right,
those like weird thoughts. And
right.
you're like, but no, it's just, you just have a high libido.
Right, absolutely, absolutely, and how that'll intertwine into her perception of the actual act, whether it's pain or it is the lack of pleasure. If your mind's not there, how will she manage to experience that joy when she's engaged in the act of intercourse?
Yeah. Yeah, absolutely. So, do you frequently hear responses like, it's okay, I don't really need it, when low desire, when you start asking about that, why do you think that is?
Well, again, it's about where the woman is. Like, is it early days and she can really dissociate the feeling of not wanting and it bothering her, or as we call it, distress? And then, or has she reached a point where she doesn't want and it doesn't even distress her anymore? So I think there is a point where the woman is thinking about it and it is bothering her, and that's the time that if she does reach out for help, um, that's a great time to reach out for help. And then comes the point of, it's not a point of no return because one can always do something about it. The question is, now it's not bothering her, now it's like, you know what, this is my new normal. And I think one can accept new normals, just like, going through perimenopause, you have these hot flashes, night sweats, and then at some point they will kind of die down or reduce in frequency, and that one can accept as the new normal. Or one can say, hey, I can actually get rid of this, even those infrequent ones, and I can sleep better. So I think it's about then nudging her to say, even if you think this is your new normal, perhaps it can be better. And it's like you're happy with an iPhone 13, but maybe the 16 can,
Yeah.
can serve you better. So it's about knowing about that upgrade, experiencing that upgrade, and saying, hey, you know what? I never want to go back to being sexless again.
I love that. I love the upgrade, right? Everyone deserves an upgrade.
Absolutely. Absolutely.
Never too late for upgrades. So, in
Yeah.
your experience, tell me about conversations around orgasm and pleasure, especially for South Asian women. Do you feel like it's hard to initiate? And do women initiate it? And I'm curious to know, like how do you like what is the terminology? Is it called, like in let's say in Hindi? What is a term for orgasm? Is there a term, or is it the English word
That's a very
orgasm?
good question. Even if I'm sure there is a word, it's just that I am I'm not sure what it is, because we don't end up using it much, or we don't use it at all. But orgasm is a familiar word for most women. It's not an unfamiliar word. I don't see them. When you asked about conversations about it, what conversations? There are very few women. Like I think it is the most part. the most difficult part of the conversation because it involves pleasure. Now it means it's not
Yes.
just serving a function, it's
Yes.
not only getting rid of pain, it's not only about meeting up
It's
to the
selfish.
desire. Now it's about me. Now
Yes.
it's about me, and most women aren't comfortable talking about their pleasure, whether it
Mhm.
is through food. Okay, I'll eat whatever is made. I will eat whatever I'll cook because he likes it or the children like it. But this meal today will be cooked because I like it. So I think that then extends into many things, including orgasm. Are we having sex because now, oh, you know what? I made it pain free because now I've got vaginal estrogen, I've got lubricants, it's pain free. And now I've also taken care of my libido because you know what? He keeps asking, but I don't feel like it. But now I've got testosterone and I've taken care of my pain. Now I feel like it as well. So it's okay. So it's not forceful. But now it doesn't really that do much for me, but it's okay. You know what? It serves the function. It does the job. So I think like that's like the least priority for most South Asian women. um, but again, as you mentioned earlier, it's got so many different parts to it. Again, it depends on where you are, and about being mindful through the whole experience. And pleasure doesn't always have to lead to orgasm. It can just be pleasure of holding hands or kissing or caressing or cuddling, or in so many different ways. But I think we are we are in some way conditioned to believe that we are here to serve.
Yes, I was just going to say that. I was waiting for you to be done to say we are people pleasers. We
Yeah,
are we are taught from an early age to serve,
yeah,
right? To whether it's to serve, not that it's wrong. There's nothing wrong with that, right? Like you can and be respectful, right? So I'm all for that. I teach my kids, it's one of the very first things I teach them is, you have to treat your elders with respect. You like, I feel like in a lot of like American culture, you have like kids calling, their friends' parents by their first name, and I was horrified when I first heard that. I was like, how can you just call, you know, Tom's parents Mary when her name is Mrs. So and so, right? Like they just say, "Hey, Mary," or like, like my kid's friend, my eldest son's friend, right? He would call me. He'd be like, "Hey, Sadaf, how's it going?" And I'm like, "Who is this kid? Why is he calling me Sadaf?" Like, I should be called like Mrs. So and so or something, or
yeah,
Dr. Lodi or something.
yeah,
But he's
yeah,
like calling me Sadaf, like we're like buddies or something. It's so weird. So I think like we're taught, definitely respect, which is very important, right, for all of us. So that's a given. But I feel like, we're taught to not really tend to ourselves and really to give, right? To give more than we receive, to always give. And I find that in myself too. Like I am constantly giving. And I had to stop one day and be like, why am I like this? Why
yeah,
am I
yeah,
always giving? And I realized it's my mom. My mom is
yeah,
always giving. She's
yeah.
always giving to her. And not that there's anything wrong. I love my mom. I love you, mom. Anything wrong with that. But my mom is always giving. She gives to everyone, everyone, everyone. And I grew up seeing that. So then I became a giver. And so I'm always giving, giving, giving. And sometimes you do that at the expense of your own, I don't know, happiness or comfort, but you still give. Um, and I think that that also plays into like our relationships and into our even sex, right?
Yeah, absolutely. And I feel like, you talk about your giving, and so it's like I think a lot of Indian households even today would have the girls serve everyone a meal,
Of
right?
course. Always.
And yeah,
Always.
yeah, yeah, yeah. And it's great to serve, but I think the boys also need to learn how to do it. So if the girls are going to serve, then the boys should do it as well. If the girl's going to learn how to cook, and I remember my father saying, and of course, loved my father to no end. But the point is, I remember him telling me when I was in med school in Hindi, he basically told me, in the end, you only have to make the rotis. And it made me so furious that, this is not
Even with
this is
all
not
that education,
acceptable. Yes.
right? Even with
And I
all
don't
that.
mind that. I don't mind that I have to also cook, but don't say in the end you have to do this. If we struggle hard, through all of it, and we still come out of the storm, right? We go through the pregnancies, the perimenopause, the breaks that we have to take in our careers, but here we are, right? Here we are, we're still talking about it. And I feel like that we don't change that story, that narrative of women are here to serve, it will percolate into everything, including sexual health, right? How are we going to, if it's not about my pleasure, why isn't it about my pleasure?
Yeah. Yeah.
And so that's something that I feel like, even with my children, I'm very particular. You know uh, they often say, oh, you go to the other extreme of being fair, because for me everything is, if he's been told to do something, then she should also, and the other way around, because that's the way it is. Because in my head, I don't want to be that mother who was not fair about the whole boy girl
Mhm.
thing. It's so important. It is just so important. But hopefully the story is
Yeah.
changing.
Yeah. So I think you're right. I think that like, so not only are we women that go through all of the biological changes that all of the other ethnicities go through, right? Like everybody goes through this, but we have this added layer of our
Yeah,
culture
yeah,
that
yeah.
that tends to, not all, but tends to keep women a little bit lower, right?
Mhm,
On that
mhm.
social ladder, um, for whatever reason. I don't know, for the patriarchy in our countries or whatever. Or there's a lot of, as there's a lot of misogyny in our countries, right?
Yeah.
And so we're also dealing with that. But like you say, we survive and we come out better and we are stronger. But there is a lot. It's like almost like an uphill battle a little bit, I feel. And I see that also with our patients, right? Our patients are also going through the same similar thing. And so, we often hear that sexual satisfaction can improve with age for some women. Do you think increased self-awareness and better communication around pleasure play a role in that? And how do you think that's different for South Asians?
I think definitely a lot of women, as they approach midlife, think that, or believe, or experience better sex just because now they know their body well, they're able
Mm,
to speak their voices. Like a lot of us have, a lot of women I know of my age now are like, they become the no nonsense person, right? The nonsense that they would take earlier
yeah.
is now no longer exists in their life, because now, okay, you know what, I've crossed midlife. I don't have the bandwidth to take nonsense. So I think women become clearer in their thought in many ways. It's a different story, that desire and everything else starts to change, and that's a pity, because at the same time, when we're getting a better grip on understanding our bodies and where we may experience pleasure
I
and
know.
how we would prefer to be
Yeah.
touched or felt, while that's happening, it's like, boom, my hormones are gone, I don't feel like it.
No,
So so that
it's
is a
true.
bit of a paradox. But I think beyond that, if one is able to correct that, and we're looking at women who could be in would be in a really good place with sexual health. When it comes to looking at the whole South Asian cultural perspective, the biggest problem is, I think, communication. So
Yes,
not only communication with their doctor, but with their partners. So there is that
100%.
still. Yeah, I know what makes me feel good now. I know what will help me orgasm or feel that pleasure. But you know what? I'm too shy to tell you about it, because who talks about these things? It's not right.
Well, you were saying about communication. We know that through research, we know that the number one factor in satisfying sex is communication. And if people are not communicating, then nobody can read your mind, right? Even though we think our partners that have been with us for a million years should be able to read our minds, they unfortunately still cannot read our minds. And so they're not going to know until you tell them what you like and what you don't like.
Yeah.
And I think that just what you said, finally understanding your body, finally understanding anatomy, right? The education around anatomy is just not there, whether it's for shame or taboo, or it was just never taught, right? Like, I know that in a lot of cultures you can't even, you're not even supposed to look at your own anatomy, right? Because that's considered dirty or shameful. And so if you're not even able to look and you don't know what's there, you may think that you're going to deliver a baby out of your urethra or your anus, and something's going to happen there, right? Like the education is not
Uh,
there. And so
Absolutely, absolutely,
and so
absolutely.
until you learn the education, until you become empowered, can you then, talk and communicate to your partner? But until then, everything's like a big mystery and you don't know what
Mm,
that's even going on.
absolutely, absolutely. You're so right about it. Communication is key, and yeah, I
Anatomy.
think like I feel, yeah, I don't know if women are even communicating with themselves,
Yes.
and so it, yeah, I think that's, yeah, you're right. Communication is key. Yeah.
Yeah, communication, like you said, communicating with yourself is like even knowing and realizing, right? Like if you can't look at yourself, right? And if you can't like touch yourself and know what you like, what you don't like, you're never going to know. And then you can't tell somebody else what you like, what you don't like. It just it becomes then sex definitely becomes a chore, right?
Right,
Because
right.
then it's you're literally there to serve, either to be a vessel for a pregnancy or to serve for somebody else's pleasure, but not for your own,
Absolutely.
because you never even learned what you liked, right? So I think that's where you and I come in, and that's where our education comes in, and that's where my conversation about orgasm that I couldn't even say comes in, right?
That is funny,
Yeah,
but that's so true. It's just so interwoven into who we are
yeah,
today, and yeah.
yeah, yeah, definitely. So before we go, I'd love for you to offer three practical pieces of advice to South Asian women navigating sexual health in midlife. And what would those three pearls be if you could give somebody that?
Well, I think the first one would be communication. Communicate with yourself, with your doctor, with your partner, and when you think it's appropriate, communicate with your children so that they don't feel
Yes.
shame attached to sex and what it can offer.
100%. 100%.
I think to not accept pain as a normal, do not normalize it. Give yourself
Yes.
permission to feel pleasure, to prioritize your health. You are important. The me, being just focus on me, one can't fill with an empty cup. If your cup is full, you'll be able to give more. Be the giver, but give yourself first. And I
Yes. I
think
love that.
the the third one would be, hmm, let's say, I would say, look at midlife as your opportunity to change the narrative. So, whether it is, you spoke about it earlier, about it being such an important transition with regards to cardiometabolic health, but this can be your opportunity to also change how you feel about sexual health, because we've reached a stage where we've got such a range of experiences and the maturity to deal with so many different aspects of life, and I think that can so beautifully be blended in with sexual health and the experience of sex for the woman. So yeah, I think changing the narrative would be my third piece of advice.
I love your advice about be a giver, but give to yourself first. I love that. I think that is something that as South Asian women, we don't hear enough, and not in a selfish way, right? We're not talking about only thinking of yourself or anything like that. I think that sometimes it gets taken to the extreme. That's not what we're talking about. But we're talking about, like you said, filling your cup first, right? Like seeing what's going on, how do you feel, and being kind to yourself, giving yourself grace, and just treating yourself like you would a child that was like 5 years old, just being kind, loving, all of those things, because it's so important to love yourself first so that you can give that love to others. So I love it. I love it. And I love those three pearls. And for all those people that are watching, that are listening, and they're like, wow, Dr. Sukhpreet is amazing. I love her. How can they follow you? How can they, let's say they live in Mumbai and they want to become a patient. How could they do that?
Well, so I'm on Instagram. That's at Menopause Wize. That's Wise with a Z. And we have just recently launched our Menopause Wise clinic. That's the first in Mumbai.
Amazing.
It's been 3 months, and we're hoping to grow it through different cities by providing different services. The goal is to provide comprehensive, multidisciplinary care that every woman deserves. So, yeah, that's where we are.
I
Thank you
love
so
it.
much.
I love that you're making such a global impact and such a global difference. So, here in British Columbia, when you're here talking about menopause, and then in Mumbai, when you go and you see patients in your clinic, that's phenomenal. So thank you. We need more people like you in the world. So thank you so much for all that you
And
do.
like you to talk about this, and yeah, it's been an amazing conversation with you, Sadaf, and I think if we would not have a time limit, we'd probably go on for many more hours.
I
But
think so
thank you
too.
so much for having me here.
Yeah.
Thank you for
Yeah.
everything
No.
that you do.
Oh, thank you. So, well, we are done here. It's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health, make sure you go speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So, thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.